I'm Jolanda Luime. I work as an epidemiologist together with the Dutch team on iPROLEPSIS. And iPROLEPSIS stems from an idea I think we had back in 2017 or 18 already, that we wanted to measure the activity of psoriatic arthritis in a different way. We didn't have a specific conception of what that exactly looked like, but we knew already then that it should be something to do with movement, because psoriatic arthritis is hugely affecting movement. And therefore we quickly came to this sort of idea, doing something with the phone or something with a watch, but we were more hanging towards the phone because everyone has a or many people have a smartphone. And then I think in 2020, we approached Leontios Leontiadas, the professor in electroengineering in Thessaloniki University, because he ran, at that moment, I think they already almost finished iPrognosis, which is a study in Parkinson's disease. And although Parkinson's its origin is very different, it both affect human movement. So we thought if you can apply that to Parkinson, we might be able to apply that to arthritis psoriatica. And then we first started off with a small pilot with only looking at accelerometer data for the phone and some keyboard keystroke dynamics, which is the typing pad. And that's still running, so we don't know exactly what that's going to look like. We did some experimentation already, which looked very promising. That is very easy to see changes in movement patterns. And now in iPROLEPSIS we are able, with the European funding, to do a lot more than only the very basic stuff we initially thought of. So now we can also look at movements, capture them by photo and video. We can look at stress. So it's allowing us to better understand what exactly does psoriatic arthritis look like if we can capture it in data, but also maybe to predict whether someone's having an increase of disease activity. And if we are able to reach that point, we are allowing patients, I think, more understanding of the disease, maybe preventing flare rather than undergoing it, because I think they are still in trial and error. That they do just too much, they get a flare, and then the flare can take a few days, but it also can take quite a long time to get rid of. So that's sort of, I think, where I dream of if I think about iPROLEPSIS and its results. I hope that our patients are able to understand their body better and to make different choices than they are currently able to. Yeah, so I hope we can make that more clear to them, or to make the decisions probably more easier for them. And then for the clinicians, I hope we can give them a better insight of what's really going on and whether they should increase medication or decrease medication, because now sometimes they see that the patient's not really well, but they are not sure whether it's inflammation, and then they decide not to increase the medication. And sometimes you might just need to do that and to see what's happening. So I hope we give them a better way of measuring the effectiveness of their treatment. Yeah, and also that what you hear, if you ask them about so in the Netherlands, and it's not in every country the same, but in the Netherlands we have a very strict 10-minute system. So you get 10-minute consultations. And then sometimes you see a patient 5 times a year, sometimes 2 times, sometimes 3 times, but 10 minutes is really, really little time. And then you have to do all the clinical examinations and also talk to the other person. So if we can not necessarily skip the consultation, but reduce the time you need to spend on measuring, because we give you already a number, I think that would ease their working lives as well. And then they can have a little bit more of the what really does matter to the patient conversation. So I hope that in the end we also succeeded this part. But it's still a long way to go.